hello. A very warm welcome to everyone who has joined us. This is Lifestyle Champions International, and we are an organization that does something very, very important. We share the gospel. I'll call it the gospel of lifestyle, a healthy lifestyle. We have the vision of raising like-minded individuals who are ready to make healthy lifestyle choices on a daily basis. And I'm sure that you've been with us since the launch of the organization in September 2020, and this is going to be our third webinar since the launch. We had the webinar on heart health, COVID disease and your heart. That was last month. And here we are again. And I really want to appreciate everyone who is on board already. And I want to welcome you, especially for making that decision to join us. I like to call people lifestyle champions when they join events like this, because I believe that joining that event signals a message that you want to make a healthy lifestyle choice. The webinar is on healthy eating. You want to find out what is healthy eating about. I want to be healthy, and so let me find out what is going on. So you're a lifestyle champion if you can take what is being shared with you today and make it a daily habit, something that you can fit into your lifestyle anytime, any day. Someone made a comment and said diets usually fail, and that's true. Diets fail a lot because they are not sustainable. But when you find out what is healthy and what is sustainable, then it will be fun. It's something that you can build into your daily lifestyle. So welcome once again. I want to recognize the presence of the board of trustees of Lifestyle Champions International. We have the chairman of LCI with us, Dr. Abel Adegoke. A pleasure to have you, sir. Thanks for your support and your advice and all that you do.
Thank you.
We have with us, I'm still going to talk more about her. She's also one of the trustees and our speaker for today. That's in the person of Mrs. Grace Adegoke. I'm going to be sharing more about her shortly. We also have Dr. Kehinde Makinde, Dr. Taiwo Makinde. You're welcome, sirs. We just marked their birthday a few days ago, so we're still in the spirit of celebration. All right. Then we also have Miss Morike Makinde. Are you here? If she's not here, I'm sure she will join us shortly. We also have Mrs. Orekola Day. She's my twin sister, we all know, and we're in this together. You're welcome, sis. I also want to recognize the associates of LCI that are here. I can see Dr. Kane Spieth. You're welcome. I'm sure many more people will be joining us. But because of time, and we really need to get into the business of the day, we're going to set the ball rolling. And I'm going to be introducing our guest speaker shortly. So now, is there anyone here that doesn't eat? I'm sure there is no one here that doesn't eat. We need food to survive. I've heard people make comments saying that they're living a fasted life. And I wonder, is it a fast from food or something else? But the fact is that even if you have to fast at any point in time, you need to break your fast. And so we need food, and you find food practically everywhere. Food comes up at events, it comes up at occasions, at celebrations. And usually if the food doesn't quite meet the mark, then it will be as if the event, failed. But now, if we have to eat all the time, and there is a saying or a quote from the ancient Greek philosopher, Hippocrates, who said that let food be your medicine and medicine your food. And you also have heard a quote saying that we are what we eat. So food is so important. But what's the problem with food? We've discovered that unhealthy eating habits, unhealthy diets are linked to and our speaker is going to be sharing more light on this topic. If you know you could make a healthy choice that would prevent you from developing a lifestyle-related disease or from developing complications of that disease, if in fact you already have the so-called illness. And we're talking about illnesses like hypertension, type 2 diabetes, metabolic syndrome. You know, there's so many of them that we can actually prevent from happening. So I'm going to be inviting Mrs. Ronke Adegoke. But I'll just share with you a little bit about her. Close to me. I've known her since my childhood. She's played a very significant role in my own life, and she's also been a prime example to me in many areas, especially when it comes to lifestyle. So Mrs. Grace Ronke Adegoke, she's an advanced nurse practitioner. She's a nutritionist, and she's also a businesswoman. And she's run some catering services. In fact, I think she still does that, despite the fact that she's practicing full time as a nurse. But she's very passionate about chronic disease management, and she believes that fitness, food, and optimum nutrition play key roles in health outcomes. She teaches healthy eating and cooking, both in practice and in the community. Mrs. Grace Adegoke has a huge passion for health promotion and prevention of diseases. She dreams of a world where affordable and quality healthcare will be accessible to every human being. So I give to you this evening, Mrs. Grace Adegoke. You're welcome, ma'am.
Thank you so much, Dr. Ore. That's a beautiful intro. Thank you. And I want to welcome everyone. I'm not going to need to introduce myself again. And I can see so many people coming up, and I'm so happy. And let me just let you into a secret. This is one of the things I've worked towards since I have a passion in food. I think I was 8 years old since I was making jollof rice and stuff like that.
Wow.
But as God will have it, He puts me in the medical line, and not just practicing, bedside, consulting, diagnosing, prescribing to patients in general practice in UK. And I pushed myself and went on and studied public health nutrition. So enough said. I'm just going to go straight and follow my notes, so I don't, deviate from the plan. And of course, because I can talk about this issue till thy kingdom come. So I have some icebreakers here. I wish these were interactive. Of course, COVID will not let us sit down together in one room, but this is still a room. So we are going to maximize. If you have any question, just put it into the chat and Dr. Ore can interject so that we talk about what people want to know, not just what the agenda is all about. And that is the plan. So why do we eat? That's the question. And I feel that's a kind of an icebreaker because many people have different reasons for why they eat. But I suppose general reason is to feed the tummy because we are hungry. So you are supposed to be answering those questions, but it's not going to work with the answers in the preamble for Zoom event. So, and what do we do?
They can put the answers to the question in the chat box.
Good. Okay. Yeah, and we can review that at the end of the program. So, and what do we eat? So these are part of the things that we're going to talk about as we move on in the program. So also talking about cooking methods, food portions, global trend around food, and especially the trend in Nigeria or amidst the Black ethnic minority, whether we're at home or abroad. Okay, and do you think you are eating well? And why do you think that? And is there anything that you think you can change? You know, your attitude towards food, perhaps, or just an overall about what you are eating generally. And as Dr. Ore has already said, the Greek doctor, the father of medicine, Hippocrates, in the 400 BC, he said that profound statement, let food be thy medicine. This guy is regarded as the father of the modern day medicine. So since when he was around 400 BC, he already said that, you know. So part of my icebreaker is to ask you who said that, but she already said that, so I repeated, I don't have to ask you that question.
Out of the bag.
And when was it said? Already done. And to whom was it said? And I think that is the question that is left for us to answer. Okay, so the father of medicine, the Greek physician, he learned the act of medicine from his own father and passed it down to his two sons, and established the first medical school. And with all of his work, his acumen, his brilliance, he still said that statement, let food be thy medicine. And today, when we look into our practices around food, is food truly our medicine? And that is the question that we need to